Okay, let's get started. First and foremost, welcome everybody to the Three Wells webinar, where we're going to cover dosing of CBD and other cannabinoids. And I'm happy to say that this webinar is sponsored by a valued partner of ours, Papa and Barkley. So this evening, as I mentioned, we are going to be covering, are you taking the right amount of CBD and or other cannabinoids? And these are questions we'll dive into, and we'll also give you an opportunity a little bit later on to submit questions that Dr. Debbie will be answering live. And your MC for tonight, which is me, Jason Turner. You see my face on the screen right now, I hope. I am your MC, as I said, and co-founder and chief marketing officer of Three Wells. And our special guest and our chief medical advisor, who will be walking you through the details of dosing and answering all of your questions tonight, is the special Dr. Debbie Malka. Dr. Debbie Malka is a physician specializing in cannabis medical consultations. Prior to clinical practice, Dr. Debbie completed her PhD in human genetics from Columbia University and studied both natural and traditional medicine, with degrees from the University of New Mexico School of Medicine and the Santa Fe College of Natural Medicine. And if that wasn't enough, there is even more. Dr. Debbie is both a clinician and an educator in cannabis. She also served as the medical director for the Medican Inc., a group of clinics providing medical marijuana evaluation in California. They served over 300,000 patients. So you can imagine the experience that Dr. Debbie has and that she's bringing to all of us tonight. She is currently the faculty director for an online CME accredited course in clinical cannabinoid medicine sponsored by the Society of Cannabis Clinicians. And of course, she's extra special to all of us here at Three Wells, as she is our chief medical advisor. As I mentioned, tonight is our Three Wells webinar, and we have a special support by Papa and Barkley. And I should mention that the reason they're special is, one, they're a great company, but also at Three Wells, we're very careful about the products that we have on our site and those that we partner with. We see ourselves as the champion and advocate for all of the people that visit Three Wells, and that's why we're so careful about who we partner with and the products that we have on our site. So we are proud and confident to have Papa and Barkley with us as a sponsor. Also, so tonight, brought to you by Three Wells. For those of you that are new to Three Wells or maybe have not come across us, thank you for being here. We really have a core focus at Three Wells, and that is to bring, through cannabis and other cannabinoids, the ability for anyone, 40 plus. We focus on the older market, and all of us at Three Wells are in that market as well, or of that age. And we really are focused on being well, living well, and doing well for and with everyone that we come across and that we help at Three Wells. And that's where our name comes from, to be well, live well, and do well. So a couple of logistics items for tonight. We're going to run about 45 minutes. We're going to have at least 10 minutes of Q&A. That may go over. We have over 300 people registered for this evening. If we need to go over, we will, and you're more than welcome to participate in that Q&A. You can submit questions by opening your chat window, which is if you don't see chat in your toolbar as part of the webinar, you can click more, and you'll see the ability to chat. I will get your chat questions if you have any, and I'll be asking those of Dr. Debbie toward the end of tonight. There will be a replay of this webinar. Will be available by early next week at the latest, and we'll make sure that when you land at threewells.co that you'll see a place to easily navigate to replay this webinar. We do ask that you keep in mind that we make no representations or guarantees about your individual results that you would get from cannabis or other cannabinoids or the medical outcomes. This is purely for information and educational purposes only, and of course, we hope you all know to consult your doctor and make sure that you're working with your doctor for anything that you do take, cannabis or otherwise, to make sure you get the benefits and you stay healthy and safe. And that's really what we want for you tonight. So with that, we are going to dive in. And at this point, we are going to get into the details of dosing for what you want and need from CBD and other cannabinoids. And I'm going to turn it over to Dr. Debbie, and she is going to walk us through the dosing and the details behind all of that. So with that, Dr. Debbie, can you please take it from here?
Hi, folks. I'm glad you could tune in, and we're going to go ahead and start with the next slide, which gives you an overview of what we're going to talk about tonight. Okay, what you're going to learn tonight is actually a little bit more than what's summarized on this slide, but the main 3 points are you need to know what you're taking. You can't talk about dosing unless you know exactly what's in your product. We are going to talk about how much to take and about important dosing considerations. And I just want to outline what some of those are. Important considerations have to do with your own body. That's why dosing is individualized. And we'll first learn about the cannabinoids that are in cannabis, and then the endocannabinoid system that cannabis interacts with. And that's where your own body comes in. And you need to know whether you're new to cannabis or whether you are an experienced consumer. And then we're going to talk about the dosing of some specific products like tinctures, vaping, and topicals. And we're going to talk about the difference between the different kinds of CBD that you might purchase out there. And wrapping it up, we're going to talk about how to regulate your dosing by your tolerance level. That's an important concept. And lastly, how to stop. So your first job is to read labels, read labels, read labels. If you are growing your own homegrown cannabis, you definitely should send it out for lab testing. Otherwise, you really can't be good at dosing unless you know what you're taking and the concentration of it. Dosing becomes a real problem. So what's the best approach for new users? In cannabis, the most well-known chemicals in cannabis are called cannabinoids, and you see 4 of them there in the bottom of your slide. CBD, THC, CBD acid, and THC acid. And these are compounds that occur in cannabis, but they also occur in other plants. You'll see a picture of the hops plant down there on your screen, and that's another common plant that has cannabinoids. So for a long time, it was thought that cannabinoids occur in the plant world only in cannabis, but that's actually not correct. Some people also refer to cannabinoids that are in our own body. Those are called endocannabinoids. Plant cannabinoids are called phytocannabinoids. So the most famous cannabinoid that you've probably heard about for a long time is THC, tetrahydrocannabinol. And there's a long list of functions with it, but this talk is about dosing. So keep in mind that there are differences between THC and CBD. And THC is most well known for it making you feel good, euphoria, stimulated. It all depends on the dose, and we'll talk about that. The next cannabinoid that is very prevalent that a lot of people are interested in is CBD. That's cannabidiol. And that's most well known for its relaxation, calming response, but it has many other functions. Some of those functions are shared by THC, such as anti-inflammatory, immune modulating, muscle relaxant, neuroprotection. Both CBD and THC do all of those functions. So you can sort of think of CBD as your relaxant and THC as your stimulant. And you actually probably already know that. This is a review. But for those of you who don't, next slide, we're going to talk about cannabinoid acids, which most people don't know about. And I'm really excited that Papa and Barkley is carrying a tincture that's made up purely of cannabinoid acids, because these are really great compounds that are extracted from cannabis in its raw form. And the reason you heat cannabis usually is to convert these cannabinoid acids into their respective compounds. So CBDA turns into CBD, THCA turns into THC. The important thing about CBDA and THCA is that they are not psychoactive. And they do have many important medicinal properties, such as anti-inflammatory and immune modulating. So there's lots of good cannabinoids in cannabis. They're not the only things in there. We'll get to some other components of cannabis a little later. And now we need to talk about where these cannabinoids act in your body. And the place that they act is your own endocannabinoid system. So what is your endocannabinoid system? The endocannabinoid system is a system that involves cannabinoid receptors that bind to our own endocannabinoids that also bind to THC in particular, not so much to CBD. And they're scattered all throughout the body. The endocannabinoid system is responsible for regulating almost every physiological act that we have: autonomic, nervous, immunological, even temperature regulation and appetite. So it's a very powerful system, but the most important thing about it is that its job is to keep you in balance. In science, we say to keep you in homeostasis. That is an important concept for dosing. You don't want to overbalance your endocannabinoid system, and you don't want to underbalance it. You want to find exactly the right place where you're actually in homeostasis. Your own personal balance level can be thought of as your personal endocannabinoid tone. So if it's deficient, then you'll benefit greatly from cannabinoids that you get outside your body, such as plant cannabinoids, such as cannabis, including THC or CBD. We need to learn two important facts about the endocannabinoid system and these two cannabinoids because it's greatly misunderstood. THC binds directly to endocannabinoid receptors. When it binds to them, it activates the endocannabinoid system. It's a stimulator. CBD does not, never did, directly bind to endocannabinoid receptors. The action of CBD is really complex. It acts through many pathways. So combinations of CBD and THC take on more significance because the CBD is actually regulating what the THC is doing. So when you read articles that talk all about the endocannabinoid system and using pure CBD, it may not be as relevant unless THC is in the mix. What you want to do if you're a new user is first you need to know what your condition is, and you may need to consult with a cannabis medical consultant. Because going into a dispensary and just buying something over the counter, you're really kind of counting on a non-medical professional to help you pick out what you need. If you want to be your own advocate, do some research, find out what kind of medicine you need before you walk in. Then when you get your medicine, make sure that it's lab tested and you know what's in it. You also need to be able to read the concentration of the medicine, if it's a tincture or a vaporizer or even raw flower. You need to know how strong your medicine is. The very two rules of dosing for new users is to start low and go slow. And then especially with THC, you want to use small amounts to start with because that can have some nasty side effects. CBD, on the other hand, really doesn't have very many negative side effects, especially at low doses. Okay, we're going to talk now about how to dose THC. We'll start with that. There are really three ways of delivery that dosing is applicable for that we're going to talk about: inhalation, oral, or topical. Right now, we're going to talk about inhalation. Dosing is so easy. You start with one puff, you wait 15 minutes. If you don't feel anything, take another one, and that's going to last you 2 to 4 hours. Tinctures are great for new users because you can actually titrate the dose by the drop. Edibles are a little bit more difficult for new users because sometimes they're too concentrated and your dosing is like by the bite, although there are some edibles that are in smaller concentrations. And we'll get back to how to dose a tincture later on. CBD, of course, is the same, but as far as, 1 or 2 puffs and then how many drops to use, which we'll get to, but you need to know which kind of CBD is in your product. And this is most confusing for consumers. Cannabis at one end can be a botanical full plant extract that's CBD rich or mostly CBD, and it has all the other chemicals in the plant. Or at the other end of the spectrum on the bottom of the slide, it can be purified CBD that has no plant components in it. It's just a pure drug, CBD. In the middle is where the whole question comes. What is hemp-derived CBD? And there are many different products out there. Some hemp-derived CBD has full plant extract with it, and some hemp-derived CBD is pure CBD. So you're going to need to look at your product and know what's in it. You might see tinctures that say a 1-to-1 mix. That means 50% each of CBD and THC. A 30-to-1 mix means mostly CBD, 97% with very little THC, 3%. And in order for CBD to be classified as hemp CBD, it has to have less than 0.3% of THC. So here are a couple of Papa and Barkley tinctures. We see the 30-to-1 and the 1-to-1. Also keep in mind that the labeling has changed over the years, but currently the custom is to list the CBD content first. So a 30-to-1 is 30 times CBD to 1 time THC. A 1 to 30 is 1 times CBD to 30 times THC. And in these particular tinctures, they're very concentrated. They actually provide 30 milligrams per milliliter of the combined mix of the cannabinoids, which translates to approximately 1 milligram per drop. So if you start dosing, you can dose by the drop, 1 drop, 2 drops, 3 drops, 4 drops, 5 drops. So 5 drops will give you 5 milligrams. That's a good dose to start at. And of course, 10 drops would give you 10 milligrams. And then the last method of delivery are topical methods. And topicals, it lasts only 4 to 6 hours. So you have to reapply as needed. It's not kind of like you put it on and then it lasts all day. The exception to that are transdermal patches, which do last all day. But they're different than topicals. They're actually designed to deliver the message into your bloodstream. You also want to look at the concentration of your topical. I've actually seen topicals that only had 5 milligrams of cannabinoids in a whole jar. That is really true. So a good concentration to look for is maybe 200 milligrams of cannabinoids in a 2-ounce jar. And Papa and Barkley's actually has 600 milligrams in slightly smaller than a 2-ounce jar. So it's very concentrated. And that means you're going to get a lot of medicine as you put on your one layer. There is a question of what microdosing is. I did mention that if you use a tincture, you're getting 1 drop, gives you 1 milligram. In cannabis, microdosing might refer to using 1 milligram or less of cannabinoids. The cannabis world did not develop this word microdosing. It's actually used in drug trials, and it really refers to getting down to the lowest effective dose rather than the highest effective dose. So in botanical medicine, we're not trying to always use more. We're trying to find the right dose. So microdosing applies to a lot of naive or new users who do want to start at the lowest effective dose. This applies especially for the elderly who are very sensitive. The other thing you need to know is that low doses of cannabinoids are important because different effects occur at low doses and at high doses. So we need to consider some other factors of dosing, not just how much to use or what your own endocannabinoid system is. And we're going to talk about that in the next slide. So I want to talk about something called the Entourage Effect. And that's a scientific word that refers to the fact that you have a lot of different components in cannabis. And if your product is a full plant extract, which has all the different components, they actually help each other to be more effective. So your dose can be lower. For example, if you have purified CBD and it doesn't have any terpenes, it doesn't have any flavonoids, it doesn't have anything else from the plant, you may need to use 10 times the dose as botanical CBD. This picture over here represents 4 of the most common terpenes in cannabis. The black pepper is related to a terpene called beta-caryophyllene, which is anti-inflammatory, also found in black pepper. The citrus relates to a terpene found in cannabis called limonene, which helps elevate your mood. The mango refers to a cannabinoid found in cannabis called myrcene, which is sedating, and the one you want for insomnia. And the lavender relates to a terpene called linalool, which is relaxing, what you want for anxiety. Okay, another important dosing consideration is what your tolerance is. Most of you have heard of that term, but what it really means is that when you keep using a drug or a botanical or anything that binds to receptors in your body, the receptors are going to become full and you have a lowered response with repeated use. In Western medicine, usually the way they deal with tolerance is to just keep going higher on the dose of the medicine. We don't do that in botanical medicine. In botanical medicine, we want to get back to the lowest effective dose. So everybody develops tolerance. If they use more than about 30 milligrams of cannabinoids a day, they're going to develop tolerance if they're a daily user. So we're going to talk about what to do about that. This is an important part of your dosing regimen. Not only do you start slow and build slowly, but if you reach a plateau, that means that you need to consider tolerance. And a tolerance break is not only about stopping your cannabis, but it could be about switching your cannabis. Your goal is to decrease your receptor capacity. You could actually switch from THC to CBD or cannabinoid acids and rotate these so that you don't fill up the same receptors. If you're using only one product, then you might have to take a break for about 2 weeks. Some people cannot take a break for 2 weeks from their medicine. Cannabis is their medicine. In that case, they take 1 day a week off for several weeks. Remember that after your tolerance break, you'll need a lower dose than before. That's the point. So now that we have started dosing and we want to look at how long to take the medicine, and we know how to manage it, we got our tolerance breaks. When do you stop and how do you wean? And people don't talk about that a lot, but it's really important. Because remember, you're trying to rebalance your endocannabinoid system. So hopefully on cannabis medicine, your condition improves. If your condition is improving, you want to wean slowly over a period of several weeks. If you're taking 10 milligrams as a dose, try 5. Cut it in half. Even if you're taking 50 milligrams, maybe go down to 40 and then 30. And if you get to a level where your symptoms start to recur, that's your maintenance level. And that's where you need to stay. If you can keep going down and you're still feeling good and you don't have symptoms, maybe you can actually wean off. That's something you need to talk about with your doctor or your medical cannabis specialist. And so in conclusion, dosing is an individual process. There's no one shoe fits all with cannabis. That's a consequence of your own endocannabinoid system. Second of all, you start low and you go slow. That means you build up slowly, and when you wean off slowly. Remember that your pure CBD, if you're in a state where that's the only kind of CBD you get, you need a much higher dose. I would start with 10 milligrams, not 1 milligram, and go up from there, like 10, 20, 30, 40, that much. How often you use something depends on your symptoms and your method of delivery. Inhalation is 2 to 4 hours, oral could be 4 to 8 hours, and topicals 4 to 6. Remember to take your tolerance breaks and keep in mind that your goal in using cannabis medicine is to use the minimum effective dose, not the maximum effective dose. And thank you for that.
Okay, thank you, Debbie. So at this point, we are going to move to questions. And we have some questions that were submitted prior to tonight's webinar, and we have some that was submitted during the webinar. So we'll get to all of them. A quick note that this will be rebroadcast on 3wells.co. And also another reminder that if you go to our YouTube channel, we have a lot of videos coming up, and there are a few up there now. Over the next several weeks, you'll see many, many more coming up about dosing for specific ailments, pain, arthritis, digestive, insomnia, etc. So that will be another resource for you as well. But at this point, we're going to move into questions. We did get a question early on. There was a question about decarboxylated dry cannabis leaves and buds and what their potency is after 8 hours of simmering. Dr. Debbie and I talked about this one prior to tonight, and that's more for a botanist or a manufacturer to answer versus Dr. Debbie. So I'm sorry, we can't answer that one because it does require that other expertise. So I will get to the next question, which is this for you, Dr. Debbie. How would you suggest a patient to wean off of Lexapro and replace with CBD? The only other med is Prosum for insomnia, and that's a question.
Okay. Well, I do that a lot in my practice, actually help people wean off. And first of all, you have to wean off any medication under a doctor's supervision. So these guidelines I give you, do not just go home and do them, but work with your doctor. You wean off Lexapro the same way you wean off cannabis. You kind of do it slowly. If you want to go to half dose for a month and then begin CBD while you're doing half dose, that's probably a good idea. And again, your dose of CBD is going to be 5, 10, 15 milligrams maybe. And you stay on that for at least a month. And the other thing about Lexapro is how fast you wean depends upon how long you've been on it. So somebody who's been on it for only a few months can go down to 1 month and then go off. But somebody who's been on it for years, that's why you need your doctor. You might have to take, 3 or 4 months to wean off. What I can tell you is that after you're off, your CBD dose will be higher than during your weaning. So maybe 5 milligrams of CBD is okay while you're weaning, but at the end, you might need 10 or 15. For pure CBD, you're going to need to get up to at least 25 to 50 milligrams. This is with or without Lexapro. CBD is excellent for anxiety. And if you are taking cannabis CBD, if you can find a strain that smells like lavender or linalool, that's excellent. So I hope we answered that question. Dosing for insomnia is a very common question. Before we get to dosing, I want to correct another great misconception that a lot of consumers have. CBD is not a sedative, not at the doses that you're going to take. CBD is a relaxant. It's not going to help you go to sleep. The main cannabinoid you want to use for insomnia is THC, or 2 or 3 puffs of THC with myrcene. I have seen people with severe insomnia go up to 25 milligrams in an edible. So if you have severe insomnia, don't be surprised if you need a lot. There's another cannabinoid we didn't talk about. It's called cannabinol, CBN, and that's also very sedating in low doses. Don't try to get off your sleeping pills with cannabis. You have to do the same kind of weaning protocol that we just discussed with Lexapro. Take some cannabis while you reduce your sleeping pills in half and continue on the wean according to how long you've been on your medication.
So this is a lengthy question. I will do my best to get it all in here for us. So the question is this. This person has a bad knee and arthritis in their feet. They just switched from Celebrex to Advil, which does work better. They take 5 milligrams THC gummy a day. They sleep very well. They've tried cannabis products from Papa to Simpson. I'm not sure who that is. And oils so that they could stop taking the Celebrex. They want the pain reliever they take to be cannabis, but they don't like the way CBD makes them feel. It makes them feel down and slow. Plus, they have not found a combination that takes care of the pain. So, do you know a correct combo that they should try?
Yeah. Contrary to popular belief, CBD is only good for some types of pain. It's good for inflammatory pain and neuropathic pain, but pain, like the feeling of pain, is reduced by THC. So if you're having a feeling of pain and CBD is not working for you, you might need to use THC, but you don't need a lot, maybe only 1 or 2 milligrams. Obviously, if you have severe pain, that requires a higher dose. Inflammatory pain, like arthritis inflammatory pain, does respond to CBD. Don't be surprised if your chronic pain only shows partial improvement. Don't keep increasing your dose because that may not give you more pain relief. Studies show that cannabis brings about 30% pain relief with chronic pain. For milder pain like arthritis pain, some people say it works great and it brings almost complete relief. So it depends on your kind of pain. Now back to the question. As far as what mix to use, I usually recommend a CBD THC 1-to-1 mix. And you'll probably need about 10 milligrams of that. That's 5 milligrams of each cannabinoid in that 10 milligram dose. And the great thing about that is that those cannabinoids are binding to different receptors. So you're getting a double dose for your pain, 2 medicines in one. You won't get very altered, and definitely try it at night before bed, because the THC may not be something that you want to be up and about driving during the day, going to work. So see how it works at night. If you do need a pain mix for the day, you're going to have to go up to something more like a 2-to-1 CBD to THC. So in that, the THC is actually only 30%, not 50%. I've seen a lot of patients get off Advil, Celebrex, a lot of other anti-inflammatories with CBD. It is a strong anti-inflammatory. If you don't like how it makes you feel, then you've got to use a mix. You can do a 1-to-1 mix, a 2-to-1 mix, a 3-to-1 mix, a 4-to-1 mix. A 4-to-1 mix, by the way, has 25% THC. Totally safe to use during the day, and you definitely shouldn't feel sedated on that. Okay, I think we're ready for the next question.
Okay, Debbie, we've had a couple questions, one from the chat. And by the way, anyone that wants to submit questions via the chat, please do so. We have some in there already, but we can take a few more. But Debbie, we've had one question from the chat, which is what is best for arthritis pain? And we've had one question submitted along the same lines. I'll read the both to do with arthritis. One that came in via email was, my mother's 88 years old with severe arthritic pain in her hip. She also has some arthritis pain in her knee due to general health condition. A hip replacement is not advisable, so her hip pain will continue and potentially worsen. There are two questions that this person has asked, which is attached to this. What do you recommend for arthritis pain? How much, how often? And then what do you recommend for general occasional pain for an elderly person?
It sounds like I can answer both because this is an 88-year-old person, so that's elderly. And in the elderly, we usually do not begin with higher than a percentage of 5% THC in the mix. So that's a 20-to-1 mix or even a 30-to-1 mix. Start the elderly on low amounts of THC. Start anybody on low amounts of THC, but especially the elderly. So there's something else that you need to remember about inflammatory disorders such as arthritis. You're not taking a pain pill with CBD. So you can't expect to take your 5 milligrams and have the pain just go away. What you're doing is decreasing inflammation. So you have to be on it for several weeks to a month before you actually really see that the arthritic inflammation is better. Some people give up too early. So for the 88-year-old mom, 5 to 10 milligrams of 30-to-1 tincture would be an excellent way to start. You take it 3 times a day and stay on it for a month.
So Debbie, that 30-to-1 is 30 CBD, 1 THC?
That's right.
And what about the part 2, or do you feel like you covered that, which was the general occasional pain for elderly?
We got to talk about topicals for that because most of my elderly patients really love the topicals. If they have like hand pain or knee pain or hip pain, they'll just rub the topical on whenever it hurts. And then when it wears off in 4 to 6 hours, then, they'll put it on again. So that does bring added pain relief for, non-chronic pain. Topicals are great for that.
And the transdermal patches, I've tried the pop on Barkley myself, which was great. Would you recommend those?
So the transdermal patches are a little bit tricky for new users because once you put it on, the effect is going to last up to 24 hours. So you can't stop it and you can't change your dosing with it. Once you put it on, it's on. So the patches are for people who have reached the dose that they know what they want to stay on. And then they can put a patch on instead of taking a tincture or vaporizing and know that it's going to work for 24 hours. So if you want 24-hour coverage, that's when you use the patches. But it's not advisable to cut the patches. So dosing with patches is really challenging.
Gotcha. Okay. I'm going to go to the next question, which submitted by chat is, do you use a formula to calculate dosing?
So I shared with you a little bit of the formula that I use for tinctures, but you can use it with anything. You don't really need a formula. If you have an edible and it's a 10 milligram edible, you know that if you cut it in half, you're getting about 5 milligrams. For the tinctures, you have to calculate how many milligrams there are per milliliter. And the dropper is a milliliter. That's the part you didn't know. So one whole dropper full is a milliliter. If you're on 30 milligrams a day and you weigh 60 kilograms, then I guess you're having a half a milligram per kilogram. But we only talk about that when you're doing concentrated dosing, such as especially in children with seizure disorder. We talk about that. Sometimes you do milligram per kilogram with other forms of autism, but it's usually a pediatric issue. It's not an adult issue.
Okay, we'll go to the next question. What do you recommend for an elite athlete who is tested?
So it turns out that THC does come through in your urine and your blood testing. I don't know how you're getting tested. The problem with THC testing is they test for metabolites of THC. So if you've been on THC that week, there can still be metabolites in your urine later in the week. So basically, you can't take THC. This is not medical. I've heard that there are products out there that actually help you clear the THC out of your urine faster, but that's not my area of expertise.
What about the CBD side? I'm not familiar with it, the drug testing for elite athletes. Is that also, do you happen to know, Debbie, if that's a banned substance?
I do not know. I do know that I read that some world athletic organization actually approved the use of CBD in athletes. Said that that doesn't mean that every state does, but that's a kind of a global organization. So CBD is not something that you usually have to worry about with testing.
All right, we have another question, a couple more questions here. Let's see. Do you treat pediatric patients? And if so, for anxiety or OCD? And what dosage would you recommend?
I give advice to parents of pediatric patients. The way it works in California is that parents are allowed to dispense cannabis medication to their children because they are their caregivers and their guardians, and they're in charge of the dispensations. So I give advice to these parents, and the parents are actually providing the medicine. So it's really what I'm trying to say is that it's a personal family decision as to whether parents will provide cannabis medicine to their children. Having said that, hemp CBD is an excellent choice for OCD. It has a really minimal amount of THC. It's not contraindicated in children. And I would definitely recommend it for OCD. And that's where you get into the age of the child and the weight of the child as far as the dose. That's something you'd need to consult a medical consultant about to get the right dose for a child. But hemp CBD is a good choice for OCD in children.
Okay. Next question. What do you recommend for respiratory allergies?
You don't want to inhale anything that's going to aggravate your respiratory system. As far as I know, cannabis itself is not recommended for respiratory allergies. There is a thought out there that if you take CBD as a preventive medicine, since it's an anti inflammatory, over the long term, if you take it long enough, you might decrease your body's inflammatory load. And if you're having inflammatory allergies, maybe they'll get better.
I guess there's a quick question here. Do you consult by phone to patients in other states, Debbie?
I do. That's what I do. The thing is that each state has its own laws. So sometimes people are all excited about using a cannabis product. They can't get it in their state. So it gets a little complicated. But medical advice is the same the whole country over. And that's what I do. I give medical advice about cannabis. Whether a person can get what I advise, that's an issue.
I think there was a follow up to the pediatric question. Should they work with the patient's therapist for dosing recommendations?
So, in my experience, therapists have referred their patients to me because they don't know enough to answer dosing questions appropriately. I've had the experience of professionals that don't know enough about cannabis giving the wrong advice. However, if the person's therapist is knowledgeable, go for it.
All right, our next question is they're showing brain changes with marijuana in teenagers. Would a combo THC and CBD do the same, adversely affect the brain? Or is this because pot is so potent?
So, the first thing I would say is that I have not read a reputable study that shows that THC adversely affects teen developing brains. I do know that there are articles out there that say that. I do believe that they've been designed with a bias, and I'm not sure I agree that there are negative brain changes to teenagers who use THC. However, teenagers who use excessive THC to the point where they don't develop appropriate coping skills to manage their life and the cannabis medicine is doing that to their detriment, it's not good to take a lot of cannabis when you're going through development. So I don't know about the brain changes, but certainly too much THC in a teenager is a problem, and a one-to-one mix is a great compromise, especially if it's inhaled. So I would recommend a one-to-one vape pen if the parents approved of the teenager doing that.
Deb said that's the answer she's looking for. So I'm glad Deb's happy. Okay, the next question we have here is it possible to take CBD with other medications, cytochrome, P450 interactions? Does the timing matter?
Yeah, so the answer is it depends on how much. All cannabinoids are metabolized according to the cytochrome P450 pathway, as well as other medications. So if you take huge doses of CBD, then it's going to kind of overtake that pathway and interfere with the metabolism of some other drugs that you might be taking. The average person should not be taking that much CBD. That's the problem with pure CBD. You have to take really, really, really high levels of it, and there might be a drug interaction. But with cannabis CBD, no, don't worry about it.
That is all of the questions for tonight. We've answered every question that was submitted, which I'm happy we had the time to get to. So with that, a couple of closing comments and remarks for everybody. The replay will be available next week at threewells.co. If you want more information about the Papa and Barkley products that we've talked about and many others, you can go to their brand store page. You can search on Papa and Barkley on our site, or this link will be in the replay as well. We do have some upcoming webinars, another one on pain management through CBD and how to shop at a dispensary. So keep an eye out for those. We'll be emailing and putting those up on our site. As another reminder, you can see other CBD and other cannabinoid specific to conditions, medical conditions, on our YouTube channel. And with that, I will conclude our webinar for this evening, and I thank everyone who's attended, and I thank you for all of the great questions. They were really helpful. I hope you all got a lot out of it. Do keep an eye out for other webinars, and have a great evening and enjoy yourselves. Good night.